Lung cancer, like any cancer, the earlier we find it, the better we are at curing these cancers. When we find early lung cancers, we have a multitude of options, including both early surgery or using the CyberKnife radiosurgery system to eradicate those lesions before they have the chance of spreading. Most patients, when they're caught early, will not have symptoms. The lung itself has no pain sensors in it, so patients will not feel pain. It's rare that patients would be coughing up blood. When they are coughing up blood, or they become very short of breath or having pneumonia, those things usually present as a much more advanced lung cancer than if we can screen for patients, catch it at a very early stage, and have either a minimal surgery or a minimal radiation technique. Once the cancer has spread, we then become more of a situation trying to get the patients to live as long as possible. And with newer drugs and newer technologies, we are helping those patients live longer than they've ever lived. Virtually every patient who even starts with a lung mass, whether we know that it's lung cancer or not, is discussed in our multidisciplinary tumor board every Wednesday, where there are multiple medical oncologists, there are multiple thoracic surgeons, there's radiation oncology, as well as pathology. We would review those patients' images, discuss the most appropriate way, if the patient hasn't been diagnosed, to come up with a diagnosis, and then discuss what's the most appropriate treatment. That's the exact same thing that these large institutions do. We do that every week here at ETMC. Patients who have been heavy smokers may have taken a lot of damage to the lung, and they may not be able to have a whole lung removed. Some patients can have a whole lung removed. It could be that they just remove part of a lung. The pulmonologists and the thoracic surgeons work very closely to determine what surgical procedure a patient could survive on with the best quality of life. Oftentimes when surgery is not the best option, then they see myself to talk about radiosurgery, which is a way of, instead of cutting into the patient's body, delivering precise, highly acute radiation to eradicate the tumors in the lungs. CyberKnife really was the system that brought about the potential for not needing to surgically remove patients' lungs to get rid of lung cancer. And because it is so advanced and so precise that we can deliver what used to take 7 weeks of radiation to deliver it in 3 treatments and have a 98% chance of eradicating that tumor. The patients who are the best candidates for the CyberKnife system tend to have a more small and localized cancer, and those are the patients who we want to find, because those are the patients who we have excellent chances of curing. The patient really will just lay on a table. They'll be fitted into a vest that helps us to track their breathing during the radiation treatments. The robotic arm will move around them. They'll feel nothing, they'll taste nothing. Both with the treatment and after the treatment, the vast majority of them feel absolutely nothing and go back on their daily business, not only the day of their radiation, but the next day, the next week, and the next, hopefully, years and years of their life. We use the TrueBeam when the patients unfortunately have more advanced disease that may be occupying lymph nodes in the middle part of the chest, or a much larger lung cancer that's not amenable to these very large doses of radiation. Those patients are also oftentimes getting chemotherapy at the same time, and the TrueBeam is a way of then delivering very precise radiation and minimizing the side effects, but treating a much larger area. It's usually over about 7 weeks, somewhere between 30 to 35 daily treatments of radiation. Patients would come in on a Monday through Friday basis. The treatments would take about 15 minutes. They lay on the table. The radiation machine would click around them. They'd feel nothing. They'd taste nothing. Unfortunately, with these larger treatments, we oftentimes deal much more with intense side effects, which would be their esophagus can get some sunburning from the radiation starting into the week 3 and into week 4. It's kind of the buildup of the radiation weeks into treatment and goes away when they are done, but takes about a week after the treatment to heal up. When we're treating them with chemotherapy, you have chemotherapy side effects such as lower blood counts and loss of hair and things of that nature. As our chemotherapy drugs are getting better, we are curing more and more patients, whereas our chances of curing even 5 years ago was a much smaller number than what it is today. So if we can catch our patients early, it's a 3 treatment, no chemotherapy, in and out, and a high chance of cure. When we catch our patients later, it's a much more aggressive treatment with chemotherapy and much more significant side effects. One of the things that ETMC has been doing, which is fantastic, is offering lung screening for these patients who are at high risk. So if you're a heavy smoker, please stop smoking and go get a screening CAT scan of your chest, because if we can catch your cancer early, we can cure you.